And we have seen people wearing the new high-tech watches where you maybe read your emails, make phone calls, track your exercise. But what if that wearable technology could help you with pain relief?
Well, since September is also Pain Awareness Month, we checked in with a doctor to learn about the latest technology.
An estimated 100 million Americans suffer from chronic pain. That's affecting more Americans than diabetes, heart disease, and cancer combined. Now, with questions raised about overuse of prescription medications, many are looking for new alternatives. That is why Dr. Natalie Strand is here to talk about breakthrough techniques and technology to manage chronic pain. Doctor, thank you so much for being with us this morning.
Oh, it's my absolute pleasure. Thank you for having me.
And I know we're kind of using that analogy about how many people are affected by chronic pain, but let's kind of put this into numbers. How many Americans are really dealing with this?
Well, the numbers suggest that it's nearly 1 in 3 Americans currently dealing with some sort of chronic pain. So it's absolutely staggering.
And when we're saying chronic pain, I know this can kind of be a large umbrella. Can you kind of give us some examples that people would be dealing with?
Absolutely. You're right. Chronic pain is any pain that has been going on for 3 months or longer. The common examples are things like sciatica, fibromyalgia, osteoarthritis, diabetic peripheral neuropathy, all common examples of chronic pain syndromes.
And your patients that may be dealing with one of these, is there a way that they describe how that feels or how their life is affected by that?
Absolutely. I mean, it's different for everybody. So some people just have a little bit of stiffness getting out of bed, for example, but for other people, it may mean you can't even go to work, or you start suffering from depression or anxiety, or you're unable to sleep through the night, giving you the effects of insomnia. So it can be absolutely devastating for some patients. People describe pain like shock-like sensations, electrical shocks, 1,000 ants biting at the same time. So it really can be difficult for these patients to really live a functional life and even experience any sort of relief with those types of pains.
And I know that is what they're looking for, is that relief. So how is it currently that we're treating this chronic pain that they're dealing with?
Well, there are a lot of different treatments, but one of the things I'm super excited about is this new wearable intensive nerve stimulation technology that the Quell device is utilizing. Basically, it is worn on the calf. It stimulates a sensory nerve to send signals to your brain to release opioids. It's centrally inhibiting pain signals, so effectively turning down the volume on the pain signals that your body is receiving. So it's a very wonderful technology. It's used for widespread pain. So even though you're wearing it on the calf, it affects pain throughout the body.
And so, like you were saying, you know, I was saying at the very beginning, a lot of people are talking about looking for new technology or new techniques. Is this something that a lot of people will be looking into, or anything else that people might be looking into?
Well, I certainly encourage patients with chronic pain to look into this. The website is quellrelief.com. If it looks like it might be good for you, try it. It does not require a prescription, so I like that patients can be empowered to try it out themselves. There's also an app that goes along with it, allowing patients to track their pain therapies, track even their quality of sleep, because this is able to be worn overnight, which is a fantastic option for patients that experience a disrupted sleep secondary to pain. So this certainly is a new technology, and for those who want to take advantage of the app and really get engaged, I certainly recommend that as well.
Well, I know that wearable technology is really where the future is going in a lot of different aspects. I'm so happy to see that medicine is definitely getting in on that. So thank you, doctor, so much for being with us this morning. And of course, we will check out that website to see if this may be music to a lot of people's ears that are dealing with that on a day-to-day basis.
I hope so. It's really a huge problem, and anything that we can do to offer relief is very important. Thank you for having me.
Absolutely, doctor. Thank you so much again. Don't go anywhere. The Morning Blend will be right back.